Good morning and welcome to Atlantic Medical Group. My name is Dr. Eric Ibegbu. I'm your gastroenterologist and I'm excited that you chose to have your procedure today with us here at Atlantic Medical Group and AMG Endoscopy Center. We've built a wonderful facility for you to have a comfortable and a great experience, and it's my desire and my goal to make sure that that happens. We have bathrooms that are located all across the building. Feel free to ask one of my staff members if you need any help. We understand that many times when you come for procedures like this, that time may not necessarily run the way we scheduled you. Please understand that we're taking care of somebody else at the back, and we're doing our best to get to you as quickly as possible. For your convenience, we've provided free Wi-Fi that you can launch your browser and be able to enjoy, have access to the internet while you wait for your family member or while you wait for your procedure. If we can help you with anything at all, do not hesitate to ask one of my staff members. We're dedicated to providing excellent service for you, and we've put together some videos that's going to help you to understand what we do, the procedures and the services that I offer, including upper endoscopies, colonoscopies, small bowel capsules. So there's some videos that you're going to see soon that will show you and explain to you some of these medical conditions and also medical procedures that we perform. I'm dedicated to excellent service, and I'm sure you're going to have a great time with us today. And again, thank you for making the choice for AMG Endoscopy Center. It's good to see you today.
About heartburn. This common condition is a painful irritation that occurs when food or liquid escapes the stomach and pushes upward into the esophagus. The lower esophageal sphincter is a band of tissue between the lower esophagus and the stomach. It opens to allow food to pass into the stomach and then clamps tightly shut. Heartburn occurs when stomach acid pushes back up through this sphincter and splashes into the esophagus, irritating its thin lining. Certain foods, alcohol, medications, and pregnancy can cause heartburn. Heartburn usually causes a burning pain in the chest that may move upwards towards the neck. Sufferers may also experience a bitter or acid taste. Treatment options can include antacids, weight loss, and modification of diet or sleep habits. In severe cases, prescription medication may be required. About hiatal hernia. This condition occurs when a portion of the stomach protrudes through a gap in the diaphragm, which can cause acid from the stomach to escape and travel up the esophagus. Ordinarily, the lower esophageal sphincter, a band of muscle that prevents acid from escaping the stomach, is aligned with an opening in the diaphragm. The diaphragm helps to keep pressure on the sphincter. A hiatal hernia occurs when the sphincter and upper portion of the stomach push up through the opening in the diaphragm. This can prevent the sphincter from closing properly. Small hiatal hernias may cause no problems or symptoms. Larger hernias can cause heartburn, gas, chest pain, or difficulty swallowing. These symptoms may become worse when leaning forward, straining, or lying down. Treatment options can include medication, antacids, weight loss, and modification of diet or sleep habits. In severe cases, surgery may be an option. About esophageal cancer. This condition is a form of cancer that affects the tissue in the esophagus, the tube that travels from the throat to the stomach. Risk factors for the disease include heavy alcohol consumption, tobacco use, chronic acid reflux, poor diet, and obesity. Esophageal cancer forms when cells that line the esophagus become damaged and begin to reproduce uncontrollably, or when cancer cells from another part of the body travel to the esophagus and begin to grow there. A lump of these cancer cells is called a tumor. Esophageal cancer can cause a variety of symptoms, including difficulty or pain during swallowing, the sensation that something is caught in the throat, pain in the throat or chest, hoarseness, hiccups, vomiting of blood, and weight loss. Treatment for esophageal cancer depends on the type and stage of cancer and on the patient's age and health. Treatment options can include surgery, chemotherapy, radiation, or photodynamic therapy. Esophagogastroduodenoscopy, upper endoscopy. This procedure is used to examine the lining of the esophagus, stomach, and upper duodenum for inflammation, ulcers, or growths. It can rule out disorders such as acid reflux or hiatal hernia. The physician uses a small camera called an endoscope, which is inserted into the mouth and is guided down the throat. The examination usually lasts from 5 to 20 minutes. The patient lies down on his side. A sedative is administered, and a local anesthetic is sprayed into the mouth to help relieve gag reflex. A mouthguard is inserted to protect the teeth. The endoscope is carefully advanced down the esophagus and into the stomach. Air may be pumped through the endoscope to help the physician examine the esophagus, stomach, or upper duodenum. Small tissue samples may be taken for further examination. The endoscope is slowly removed from the esophagus. The patient is carefully observed after the procedure, and eating and drinking is restricted until the anesthetic wears off and the gag reflex returns. The patient may experience some cramping, bloating, or gas after the procedure. Adult constipation. Constipation is a decrease in the frequency of a person's bowel movements, a change in the consistency of stools, resulting in small, hard stools, or a difficulty in a person's ability to pass stools. Constipation is a fairly common complaint in older adults, and most people will experience constipation at some point. In many cases, it is related to a person's diet or daily routines, but constipation may also be a sign of a more serious disorder. Constipation can be caused by a variety of factors. It often results from poor diet. It can be triggered by a diet that is low in fiber and high in fat or refined sugar. In the elderly, it is often triggered by a calorie-poor diet. It can also be caused by not drinking enough fluids or by drinking too much caffeine or alcohol, which causes a person to urinate more frequently, resulting in firmer stools. Constipation is common among travelers who frequently eat unhealthy or unfamiliar foods and may not get enough fluids. Constipation can also be caused by a person's daily habits. A person who frequently ignores the desire to move the bowels can inadvertently train the body to begin to ignore these signals, causing constipation. Lack of exercise can also cause constipation, and this is a common problem for the elderly. Constipation is a common side effect of a variety of medications, which can disrupt the function of the digestive system and result in harder stools, or slower movement of stool through the colon. Constipation can also be caused by a wide variety of physical conditions. Pregnant women commonly experience constipation because hormonal changes associated with pregnancy, along with a growing womb, can disrupt bowel movements. Constipation is also a common complaint of people who have conditions such as diabetes, hypothyroidism, stroke, multiple sclerosis, and Parkinson's disease. And finally, constipation can result from problems such as hemorrhoids, gallstones, pelvic floor hypertonicity disorder, intestinal cancer, rectal polyps, spinal cord or pelvic injury, and numerous other issues. And constipation can be caused by a weakness in the wall between the vagina and rectum, which is called a rectocele. Symptoms of constipation include cramps, straining during bowel movement, hard stools, a feeling of incomplete emptying of the bowels after a bowel movement, pain in the rectum, bloating, and nausea. A person who notices a change in stool shape or consistency, or who notices blood in the stools, should be evaluated by a physician. Treatment options vary depending on the patient and the cause of the constipation. In most cases, constipation can be relieved with proper diet and exercise. Physical therapy may also help the digestive and elimination process. If these methods are not helpful, a physician may treat constipation by prescribing laxatives or other medications. In cases where the constipation is caused by an underlying disorder, treatment for the disorder may provide relief. About colon cancer. In this condition, unhealthy growths develop in the large intestine or rectum. These cancerous growths may be benign or malignant. There is no single cause for colon cancer, but nearly all colon cancers slowly develop from a benign polyp. A low-fiber, high-fat diet may also contribute to the development of colon cancer. Patients with colon cancer may suffer from diarrhea or constipation, blood in the stool, lower abdominal pain, or unexplained weight loss. Patients may also show no symptoms. If detected early, the cancer can be removed during surgery, most often through colonoscopy. For more advanced cancers, part of the colon may need to be removed. Chemotherapy and radiation therapy may also be needed after surgery. Colonoscopy. This procedure is used to examine the large intestine for inflammation, ulcers, or abnormal growths, such as cancer. The physician uses a colonoscope. That's a small lighted camera inside a soft, flexible tube. The procedure usually lasts from 30 minutes to an hour. Pain medication and a sedative are administered to relax the patient, and the patient lies on his side. The colonoscope is inserted into the rectum and is slowly guided into the colon. The physician carefully examines the lining of the colon and may ask the patient to change positions to aid the scope's manipulation. Air may be pumped through the colonoscope to inflate the colon. Small tissue samples may be taken. The colonoscope is carefully removed from the colon. The patient is carefully observed until the sedative wears off. The patient may experience some cramping, bloating, or gas after the procedure. Full recovery usually occurs in a day, and patients can return to regular activities. gallstones. This condition is a buildup of small pebble-like deposits in the gallbladder. The gallbladder is a small, non-vital organ located just below the liver. The gallbladder stores bile, which is produced in the liver until the body needs it. The gallbladder then pushes the bile into the small intestine, where it aids in the digestion of fats. Gallstones are formed by the hardening of liquid bile in the gallbladder. Most gallstones are made of cholesterol or bilirubin, substances found in bile. These can form gallstones when they are present in abnormally high levels in the bile. Gallstones may form as one or more tiny pebbles, or as a large stone the size of a golf ball. Gallstones are more common in women, especially those who are pregnant, who use hormone replacement therapy, or who take birth control pills. Diabetics, American Indians, Mexican Americans, and people with a family history of gallstones have a higher risk of developing gallstones. Other risk factors include being overweight or obese, losing a large amount of weight quickly, and taking cholesterol-lowering drugs. Gallstones can cause painful episodes, commonly called gallbladder attacks, which often follow meals of fatty foods. Symptoms of a typical gallbladder attack may include a steady pain in the right upper abdomen that may last for 30 minutes to several hours, pain in the back between the shoulder blades, and pain in the right shoulder. Gallstones may be diagnosed with an ultrasound exam, a CT scan, and an HIDA scan, which uses an injected substance to cause the gallbladder to contract, or an ERCP evaluation, which uses an endoscope to visualize gallstones. Gallstones can be removed endoscopically during an ERCP. They are also commonly treated with surgery to remove the entire gallbladder. Hemorrhoids. This condition is an inflammation and swelling of the veins of the anus or rectum. Hemorrhoids may occur inside or outside the anus. Hemorrhoids can be caused by frequent and excessive straining during bowel movements. They can develop because of chronic constipation, genetic predisposition, aging, or pregnancy. Sitting on the toilet for long periods may also contribute to hemorrhoid formation. Internal hemorrhoids form inside the anus. They are not visible, they cannot be felt, and they generally do not cause discomfort. Symptoms of internal hemorrhoids may include bright red blood that is visible during bowel movements, in the toilet bowl, on the toilet paper, or on the stool. In some cases, an internal hemorrhoid may protrude through the anus and become irritated and painful. External hemorrhoids form on the outside of the anus. An external hemorrhoid can form a hard, swollen bulge that causes pain and discomfort, particularly if a blood clot forms inside the vein. Treatment options may initially include warm bath soaks, creams, and suppositories. Drinking the proper amount of water and eating a diet high in fiber may be helpful in relieving constipation and straining. In some cases, surgical treatment is needed to reduce the size of the hemorrhoid or to remove it completely.
Hello, my name is Dr. Ibegbu. I'm a board-certified gastroenterologist with Atlantic Medical Group. Do you suffer from hemorrhoids, have bleeding, swelling, or itching? I offer non-surgical infrared laser therapy for hemorrhoids. This procedure is virtually painless and is covered by most insurances. We also offer office-based colonoscopies at our state-of-the-art endoscopy center with tremendous cost savings to you. Call us or visit us online to schedule your next appointment. At Atlantic Medical Group, unsurpassed excellence is our promise.
Capsule endoscopy for small intestine screening. This procedure is used to examine the small intestine for inflammation, bleeding, ulcers, or abnormal growths. The patient swallows a pill-shaped capsule which contains a lighted camera, known as an endoscope, which transmits video of the intestine. The physician attaches a small data recorder to the patient's waist, and the patient swallows the capsule endoscope. Over the next 8 hours, the endoscope passes naturally through the patient's digestive tract and transmits images to the data recorder. During this time, the patient can continue normal activity, but must avoid rigorous physical activities such as running or jumping. The patient returns to the physician's office and the data recorder is removed. The images on the recorder will be reviewed by the physician. The capsule is disposable and is normally excreted naturally.
Hello, my name is Dr. Ibegbu. I'm a board-certified gastroenterologist with Atlantic Medical Group. We have office locations in Jacksonville, North Carolina, and in Kinston, North Carolina. We recently completed our state-of-the-art endoscopy center and surgical center in Kinston. Now we're able to offer outpatient procedures, including endoscopies and colonoscopies in an office setting with tremendous cost savings to you.
Before, I had to go from place to place. Now with the new office, it's great. I mean, everything's done under one setting. You go in, you have your colonoscopy. After it, he's there to talk to you right then and there. You don't have to make an appointment to come back again and go somewhere else. It was very convenient. I love it.
Go into the hospital, you encounter people that you're not familiar with, whereas when you're going to an office and you see familiar faces there, and that's one thing kind of puts you at ease. Some people get kind of nervous when they have these things, and things like that put you at ease. And just having the one location to just kind of deal with, it cuts down, that's another bill that you have to worry about. And coming to one place, I think most people would agree that that's better for them.
The staff is very professional. From the front window, the receptionist, all the way through to the nurse that does the vitals, to the folks that actually perform the procedure. I was treated very, very kindly. I was treated like a person and not a medical condition or a number, and that makes you feel very good that somebody like Dr. Ibegbu and his staff gives you that kind of personal touch.
It saved me money from having to go to the hospital, and to me at this point that is a very crucial point because my insurance company has dropped me, so I'm having to pay out of pocket. So being able to go to one place and pay one bill really saves me a lot of money.
I specialize in several areas of gastroenterology, including acid reflux disease, irritable bowel syndrome, inflammatory bowel disease, such as Crohn's disease and ulcerative colitis. I perform several procedures, including upper endoscopies, colonoscopies, ERCPs, small bowel capsule studies. I'd like to share some of my patients' experiences with you through their testimonials.
Dr. Ibegbu is a wonderful doctor. He diagnosed my condition, which is celiac sprue. He found my condition when I don't think most physicians would have been able to identify it. My condition is one that is very misdiagnosed, and a typical celiac person takes around 10 years to be correctly diagnosed. And he hit the nail right on the head first time out. And for that I am forever grateful that he found my condition, he got me on the right track, with a proper diet and diagnosis, and today I am in very, very good condition.
So I made an appointment and they got me in very quickly, and I explained to him my condition and told him what had been going on, and I had been getting treatment, but my condition colitis really continued to come frequently. And so when I came to see Dr. Ibegbu, he gave me a colonoscopy, gave me new medications. They worked really well. I went in remission for the first time for years.
Well, one thing was, I said, wherever I can get in the quickest. And with you, it was, I mean, like within a couple of days, they said that Dr. Ibegbu would be, you know, that they could get me in. And that was one thing I was impressed, because a lot of places, it's, you know, you've got not just several weeks waiting list, but a lot of times several months. And that was not the case with you.
Dr. Ibegbu, from my experience, just is a wonderful doctor. He is very compassionate, he's very kind, he's very knowledgeable, and I trust him implicitly with my health. And in fact, I carry several of his business cards in my wallet, and if somebody happens to have the symptoms that needs an enterologist, I'm happy to give them his card.
I recommend them to everybody I know, and some of my family do come, and friends. I know a lot of people, and I do, because like I say, the staff are great. I will share one incident with you. On one of my visits to the office on a checkup, Dr. Ibegbu wasn't in the office, he was in his other office, but his PA was here. And I had a question that the PA couldn't answer. He actually called Dr. Ibegbu on the phone, and they talked and told him what to do, and I thought that was extra special. I've never seen a doctor's office do that.
I mean, it's only been a couple of months now that I've been introduced here, but I've referred Dr. Ibegbu to lots of people. I've told them how comfortable that you feel with you, that you're pleasant to talk with. You don't try to hurry us in and out. You act like you have plenty of time to sit and discuss whatever problems we might have, and that means a lot to people. I mean, when people are coming to a doctor, they want their problems solved, and they want answers, and they want to feel comfortable. And I definitely felt comfortable with Dr. Ibegbu and with the office here in Kinston and the one in Jacksonville.
I love Dr. Ibegbu. He is very professional, he's kind, he's caring. He cares about you, and he takes his time with you. He explains everything to you. He doesn't rush you out of his office.
He really takes time to sit down and listen to you, and he remembers, and that's a good thing.
No matter where you live in Eastern North Carolina, our 2 locations are close and convenient to you. Our office hours are Monday through Friday, 8 a.m. to 5 p.m. We accept all insurances. No referrals are needed to see us. Atlantic Medical Group is dedicated to the care of you and of your household.